So we're gonna demonstrate the wall bubbling, which is that technique to actually oxygenate your lung a bit better. So when you're starting to get poorly, nothing better. Bit of water in a glass, a pint, not too much, just a quarter or a third, some paper straws, nothing better than that. And that's your own ventilator, basically. And, you know, there's lots of advice out there, but that's pretty sound. That's really to empty your lung without triggering the coughing reflex. And you're going to actually use one of the straw to actually produce some bubbles in the water. And that's enabling you to actually control your out breath, not trigger the coughing reflex, and really oxygenate that poorly ventilated part of your lung, which is going to get more and more congested as the illness progresses, okay? The shallower, the least pressure you have to apply to breathe out. So you're going to have to find the proper height in which you do, okay? And it's going to splatter a bit everywhere. If you cough, you might want to maybe get the whole thing not too full as well. And if you're in bed, you might want to prop yourself up, okay? But that's a really great way to focus on. You're in bed, hydrate, get some paracetamol into you, and just do some bubbling for hours on end anyway, okay? And it will maybe decrease a little bit how much you cough, and in the meantime, it will keep your lung really nicely oxygenated. It's not about your lung, it's about you and your blood stream. You cough a lot, it's super tiring. If you cough for 6 hours, if it's a constant cough, you're going to be tired and knackered, okay? And the more congested your lung is, the least it's actually being oxygenated. The least it's oxygenated, the more tired you're going to be, because if your pressure, partial pressure and oxygen in your blood plummets and goes below 90%, you're going to be knackered, okay? And that's when you're going to be rushed into hospital, okay? So you want to do that bubbling as much as possible, okay? Here we're really talking about breathing into your chest, okay? But I guess you're breathing out longer than you're breathing in. That's the main point, okay? So it's really simple. It's really effective. You can do that. The older you are, the more you should do that, because the more problematic that acute respiratory syndrome is going to be for you, basically, okay? And the main thing is that you're going to get knackered much more easily, okay? So if you're asthmatic, if you're a smoker, if you're overweight, if you're anything that cardiovascular problem, whatever, if you're older, anything that put pressure on your breathing, you need to do that a lot. Obviously, when I get the whole COVID, I'll be doing that all day, basically, or not all day, but a few good hours a day. If you do that for 2 or 3 hours a day, you'll really maximizes your chance to not get too depleted in oxygen, basically. And it might sound completely bonkers, but I can tell you that's the best way. It's really proven way of actually going about. It's not a joke, and it's a quite sound advice, I can tell you, okay? So be your own ventilator. Don't actually put even more pressure on the NHS, which is already struggling for people who have underlying health conditions, really, okay? So perfect way of actually keeping your saturation in oxygen pretty high, okay?